Okay, we are at 9 o'clock, so we are going to go ahead and get started. Thank you, everybody, for joining us today. We have both Clearbrook staff and families attending today. I'm Jessica Smart. I'm the Assistant Vice President of our intermediate care facilities, which are our long-term care facilities. And I'm joined by Dr. Hameeduddin, who is Clearbrook's Medical Director, as well as the attending physician for 3 of our intermediate care facilities. Thank you all for sending in your questions. I've broken them into 2 categories. There are the medical questions, which Dr. Hameeduddin will handle for us. And then when she's done, I will try my best to answer all of the questions that were related more to Clearbrook's policies and procedures around COVID and the vaccine. We did get a lot of very specific medical questions that were related to the vaccine safety in terms of an individual's diagnosis and their particular medications, and we're not going to be able to answer those today. I encourage everybody to follow up with your or your loved one's primary care physician for those very specific medical questions. If your loved one lives at the Commons, Wilkie, or Fairfax, you can follow up with Dr. Hameeduddin through the nursing staff later after the webinar as she does her rounds, as she would be the point person for those clients who have her as the primary care physician. But all other individuals, staff, as well as clients that live in our SILA program or attend from the community should follow up with their own primary care physician to assess the risks and benefits of being vaccinated. With that, I'm going to turn it over to Dr. Hameeduddin just to give us a little background about herself, and then she's going to share some information with us about vaccines in general and side effects, and you know, some of the questions that we received. So thank you, Dr. Hameeduddin, for taking the time to speak with us today.
Hello, hi, good morning, everyone. I'm Dr. Hameeduddin. I have been in practice for almost over 20 years, and I have joined Clearbrook last year. I'm very excited to be at Clearbrook, and really enjoy seeing the residents and trying to give my best to them. And today we are here to discuss about COVID-19 vaccine and how important it is, and how does it work, and what are the common side effects, and who are the candidates who are not. And so I have reviewed all the questions and concerns that you have given to Jessica, and I have piled up into a brief summary, and will try to give the best to answer all your questions, which will be in a nutshell that I'll be presenting to you on the vaccine. And mainly the Pfizer-BioNTech that has already started in a lot of the hospitals. As of today, they have started giving at St. Alexis Hospital to all the physicians and healthcare workers. COVID-19 vaccine, as you know, is like a synthetic vaccine. It's not a live or killed vaccine, and it is an mRNA vaccine. And the way it works, it helps our body to develop the immunity to the virus that causes COVID-19 without us having to get the illness. And it typically it goes into the cell and causes the antigen response, and that causes the immune response, and just make sure it kills the virus when it gets in. It is usually given in 2 doses, and they are 3 weeks apart. The second dose is within 4 days grace period. It's in between 17 and 21 days. And it should be administered, you know, let's say if you delay the vaccine, it's better not to delay and just give in time within 21 days, but it does, then you have to just take it as soon as possible. The doses need not be repeated, and like it causes 95% immunity 7 days after the second dose. So don't think you take the first dose and you have the immunity. You have to have 2 doses. And also, the vaccine cannot be, COVID-19 vaccine cannot be combined with any other vaccines. You cannot have a flu vaccine with it, or you cannot have a pneumococcal vaccine with it, or shingles vaccine with it. It has to be 14 days apart because it doesn't work if you do like that. There's no data to, and that's one important thing. The other thing is, like, you cannot, you cannot mix the vaccine. Like now we are giving like Pfizer-BioNTech. You cannot mix with Moderna. We cannot mix with AstraZeneca vaccine. It has to be the same brand. So otherwise it loses effectiveness. So we just have to be very careful about that. And the third thing is, like if you have to give the flu vaccine or pneumococcal vaccine or any other vaccine, you have to give like within 14 days after the COVID-19 vaccine. It has to be a difference of 2 weeks. And the person with known COVID infection, like let's say if I have COVID, I cannot have the vaccine till 90 days because you develop antibodies and they hardly have no reported reinfection rate within 90 days. So we advise to wait for 90 days and get the vaccine if you have COVID infection. Either it's asymptomatic or symptomatic, you have to wait. And the other thing is, like, let's say if you're in the hospital and if you with a COVID infection and you get the plasma infusion, if you get that, then you have to wait 90 days after the plasma infection because you develop antibodies right away, So it can or it cannot, but you have to wait for 90 days. It does, let's say if you give it sooner, it does interfere with vaccine-induced immune response. We advise not to get it sooner. And let's say if you have a known COVID exposure, you don't know if you have COVID or not, but you have an exposure, we would recommend that you wait for 2 weeks and then get the vaccine. We are recommending CDC is recommending all long-term care facilities, intermediary facilities to get vaccinated because they are very high risk. All the staff, even if they're exposed to the residents, they have to be vaccinated. You don't need a testing to see if you have COVID or not prior to the vaccine. You can just get it. Patients with underlying medical conditions like heart disease, asthma, we recommend that they should get vaccinated as soon as possible. And also immunocompromised patients, like there have not been any studies in the immunocompromised patients. Patients on immunotherapy, who are on chemo, they have not been studied, but they are very high risk. So it's recommended that they get the vaccine. And as for the pregnant patients and lactating moms, they have not been any studies. So you just have to weigh, should they get it or not? CDC is not recommending they get vaccinated, but like healthcare professionals, like who are close contact with high-risk COVID patients, if they're intubating or they're in direct contact, the chances of if they get the COVID infection of them infecting the fetus is very high rather than the vaccine. So they have to weigh the pros and cons. So it's up to in case-by-case basis, you have to go. Regarding the side effects of the vaccines, I talked about, and the side effects of the vaccine. So there are side effects, 4 to 10% to get side effects, like a local rash, swelling, pain. They can have fever, they can get fatigued, headaches, and no long-term side effects have been out yet because this vaccine is very new. We don't know what will happen 3 months later into it, or even more longer. But if they have patients with allergies, let's say if they have allergies to any other vaccine, like flu vaccine, or they have allergies to pollen, or they have any anaphylaxis allergy, they could still get it, but they need to make sure that we have EpiPen there, epinephrine there, wherever they're going, and they have to wait a little bit longer. Instead of 15 minutes, they have to wait in the office, they have to wait more than 30 minutes. And it's just there's no contraindication that they should not get the vaccine. The only contraindication of the vaccine is, let's say if they are allergic to the Pfizer products, then they cannot have the vaccine, Again, let's say if you get vaccinated, you don't think that, okay, I can do whatever I want. Like still you have to follow the isolation because it's still 95% and that too after the second dose, like a week after. So I would recommend everybody continues the isolation precautions. They should wear masks, they should avoid crowds, they will be washing their hands, and they'll be 6 feet from each other. And there was a question about in our developmentally delayed patients, like in our Clearbrook patients and all this stuff, like is there any, then there have been no studies done because, but we recommend they get it, they have no reports that cause Bell's palsy or anything that we know of. And again, this vaccine is so new, we have no long-term data on it, but nothing like immediate that they give it and they get the Bell's palsy or anything like that. Anything else, Jessica, that I have not covered from the questions or concerns?
We do have 2 questions in the chat. One is, why shouldn't you get tested for COVID-19 before you take the vaccine?
Well, because, it's not, why shouldn't you get tested? Like there's no reason to, because this will not give you the COVID vaccine. Like this is not a live vaccine that will give you the COVID disease. You know what I mean? So they have not, like, that's not a contraindication. Like, it's just, we don't know. Like if they tested, let's say, who knows, they have been carriers, like who knows, they've had the positive COVID for last 3 months. They could still be showing up. So there's no point in it,
Okay.
unless you are sick or anything like that. If you have symptoms, that we would advise to do that. But let's say the way we do, Jessica, like if you have COVID, we don't recommend any repeat testing because 2-3 months down the road also you will be positive. So what's the point just checking it and then giving it? Unless you have symptoms, then that's different thing.
Okay,
but
thank
there's
you.
no recommendations to check it because this vaccine by itself, this is not a live vaccine. It will not cause the disease in you. You know what I mean? Did that answer my question, your question?
Yes, thank you. And we'll take, I'm going to pick just a few more out of the chat.
There have been there were some conspiracy theories. I don't think it's right. There have been no conspiracy theories okay, they have chips in there, they've been monitoring there. I don't think so.
Right. Can people still be carriers if they have been vaccinated?
Because it takes several weeks to develop several days to develop the antibodies, carriers for what?
For COVID. And I think that ties into, the question, why should people still wear masks?
Because they could still infect, right? It's not they should still, because it's not 100% effective. It's just 95% effective. So still they should be maintaining the isolation precautions because you don't know you are in that 5%. Just being the carriers doesn't mean that they will infect, they'll be carriers for a long time. But still, those, if they come in that 5%, or we don't know, as we don't know the long-term data of this vaccine, like how long it's going to be effective and all that stuff,
Okay, let's see here. And again, I'm seeing we have a lot of specific questions in the chat related to individual medical conditions or medications. And again, I
don't think it has not been studied that patients on these medications should not get it. There have not been any studies that, the higher risk you are, the more, that you should get the vaccine. The more sicker you are. It's not that, okay, if you are, but they have not been, and again, they have not been studied, but it's recommended that you get the vaccine,
And then, those questions, as I said earlier, are best directed to the individual's primary care physician for, one-on-one consultation for that individual. And
Yeah.
again, like Dr. Hameeduddin mentioned, you know, and my thought on it too is really just weighing out the risks on both sides, and that's a conversation that can be had with the individual and the primary care physician.
Like, I mean, like pregnant patients and all that stuff, like if they're not working with hand to hand with COVID patients, as there have not been any studies, we would recommend not to get the vaccines, you know, for now. But it's again case by case, you know.
Yeah. All right. Well, I appreciate you joining us today and taking the time to review all those questions that I sent you earlier this week.
Thank you. My pleasure.
Thank you. Yeah. So you're welcome to stay on, or I know it looks like you're busy there. You can certainly log off. I'm going to talk now about some of Clearbrook's policies and procedures related to the vaccine.
No, I can stay. I can stay on.
Okay. Thank you. So one of the questions that I received most frequently from both staff and families is Clearbrook going to make getting the COVID-19 vaccine mandatory? And the answer is we are not. It is not mandatory. We're strongly encouraging it for all clients and staff, but it's not required. There are no state or federal mandates at this point related to the COVID-19 vaccine. And then this leads into another question that I got pretty frequently is, you know, the situation of, will policies and procedures be different, perhaps for staff that are unvaccinated versus those that are, and for our clients, both those that live with us residentially and those that attend our community programs. Right now, the Illinois Department of Public Health, as of just a couple of days ago on a webinar, is still recommending that even when vaccinated, that we continue to follow all of the policies and procedures that we have in place related to COVID. So as Dr. Hameeduddin talked about, continuing with isolation, social distancing, mask wearing, PPE. So that will all remain in place. Visits will remain restricted. Going out of the facility will remain restricted. So everything for some period of time will remain exactly as it is now until we get further guidance from the Illinois Department of Public Health and or the CDC, at which point we will review and you know take those into consideration and make adjustments. But for right now, everything will stay as is. I know that's not the answer that most people want to hear. I know it's been a very, very, very long year, a lot of time away from family members, and we absolutely understand that, but we just want to continue to make sure that our staff and our clients are as safe and as healthy as possible. So we'll wait for further guidance related to that. Next one is, will Clearbrook be making vaccines available for family members of staff? Right now, we know that hospital staff and frontline workers and long-term care residents and staff are a priority. We're going to continue to monitor the information regarding the distribution to learn more about remaining staff groups and other groups such as families. I encourage everybody to reach out to their local health department. I know I live in Lake County. They're already doing online registration for all Lake County residents, so you can register and get yourself on a list. So each county is handling things differently, but I think that's a good resource for everybody. Maybe speaking with your primary care physician regarding vaccine availability, and then in later stages, possibly Walgreens or CVS. Next big question is when will people receive the vaccine? And I don't have a specific date yet. I can kind of outline where we are in the process. So for several weeks, we've been working with all of our local health departments. So that's Lake County Health Department, McHenry, Cook County, as well as Walgreens, Illinois Department of Public Health. We have all of our needs out there. We've pulled staff to have an idea of how many vaccines we will need. Right now, the first round is going to hospital staff. I learned earlier this week from the Illinois Department of Public Health that their next step will be the skilled nursing facilities, and they expect that process to take about 6 weeks. So we'll be at some point after that, hopefully in the next grouping under our intermediate care facilities and SILA, both congregate living. But as soon as we receive more information, we will get that out to you. We're not sure yet who will be administering the vaccine. We have a couple avenues. And like I said, some of it is dependent on the county. So there's one county that will be allowing Clearbrook to be a closed pod, and our own nurses would be able to administer the vaccine. If it's Walgreens or CVS and they come on site, I understand it will be their pharmacist who will administer the vaccine. If it's the health department, outside of that county that's allowing for the closed pod, it may be health department staff that do the vaccine. It may be with the assistance of our nursing staff. We are registered to be able to administer the vaccine when we get it, so we have that in place. And again, more information will come once we identify which entity will be assisting in the vaccine. You'll get a consent form that will need to be filled out for the vaccine. Let's see, and then the next one, this was a staff question. Will DSPs receive documentation regarding status as essential workers for priority in vaccination? And our Human Resources Department can provide a document indicating that you're an essential worker like they did in the spring. So you can reach out to HR if you'd like to have that. And let's see. Some questions from individuals that participate only in Clearbrook's community day programs and do not reside with us residentially, and where they may get the vaccine. At this point, it doesn't look like we will be able to vaccinate people outside of those that are employed here or work with us residentially. So if you fall into that category, if your loved one lives with another residential provider, I would suggest speaking with them. But again, also following up with your local health department. Should the status change for that group, we'll communicate that. I think that covers the vast majority of the questions, again, that were not specific to certain medications and an individual's diagnosis. So I want to remind everybody again to please follow up with your primary care physician to have those questions answered. We'll continue to send out updates related to the vaccine distribution as we get it. Most of you should have gotten yesterday a very lengthy but very informative frequently asked questions document from the Illinois Department of Public Health. It covers a lot of what we've talked about and a lot of the questions that have been submitted to us. If you haven't received that, please reach out to the director responsible for the program that you work in or that your loved one gets services in to make sure you get that. I think that's a very helpful document to have. I think the information that we have today is only as good as today. This is a very fluid situation. It's changing very rapidly. The staff here at Clearbrook continue to participate in the weekly updates from the Illinois Department of Public Health as we monitor the situation. So, watch out for the weekly updates that are coming from your programs, and you'll find more information as we have it there. So I wanted to thank again everybody for not only logging on today, but just for being with us since March through this process, and Dr. Hameeduddin, who joined us just 1 month before COVID came around. We appreciate her very much and all that she's done for us, and our staff who are out there working on the front lines and keeping the organization going. We thank you for that. It's been a long, like I said, a long year, and to the families that have been separated from their loved ones. You know, we appreciate your patience and taking, you know, part in protecting our Clearbrook community. And we just have to stay strong now and make it, you know, through this hopefully last phase of COVID, the vaccine phase, and continue to wear our masks and social distance and follow the quarantine guidelines to keep everybody as safe as possible. So thank you. If there are any other questions that we didn't answer that you have, please feel free to email me and I'll see what I can do to get back to you. My email address is jsmart@clearbrook.org. Okay.
Any other questions? No, right, Jessica?
You know, there are some on the chat, but there's quite a few, and really the intent of this was to have the questions submitted ahead of time so that we, you know, had time to prepare. I will go through the chat.
If I can answer some of those, can I see that in the chart? Share.
Let's see. Let me go through. I'm not sure.
Can I see that?
Here's one. If allergic to a Pfizer product, you mentioned not to get the vaccine. How do we know if a client is allergic to a Pfizer product?
Well, it's hard to say. You know what I mean? It's just very hard to say. They are saying, like, you know, if they have any known allergies in the past, they would know, right? Like if it's any anaphylaxis allergy or anything like that, they would look into that, what she was allergic to. Like if it's a known allergy, they know. They would know also, you know, when their physician let them know, okay, this is allergic, you know, you're allergic to it, they will know which, unless it's like if it's a medication or any Pfizer product, you know, that's the only way. Like if they're given in the doctor's office and they're allergic to it, let's say if you take any medication, so that medication you have to, if they are allergic to a known medication in the past and that causes anaphylaxis or severe allergic reaction, they should talk to the doctor where they get it and see what product it was. So they should really, and that's a very good question. You know, the patients will know what they're allergic to, right? If they're allergic to any known medication, they better talk to the physician and let them know, hey, I'm allergic to this medication, and make sure that that's not a Pfizer product. Mm-hmm. Because the way they're getting the vaccine, they should have that information. You know what I mean? Which medication is Pfizer, which is not, like which vaccine is Pfizer, which is not. So if it is like that, then they should not get it. It's very easy to find out.
Okay, thank you. Do you know if there are any effects on fertility from being vaccinated? So if someone, you know, maybe not pregnant now, but thinking, you know, long-term in the future.
Not that we know of. There have been it's not been out that long that they have studied the infertility, you know, not that we know.
There's another one. I'm still not clear if people can be a carrier if they get the vaccine. I know it's 95% effective, but does that mean that 95% of you isn't a carrier?
Well, it's very hard to, it's very hard to know. It's not, you know, this is something that we don't know, you know.
We don't know if even once vaccinated, even, you know, beyond that, you know, 5% where it may not be effective. So we don't know with the other 95%, although they're protected, they could potentially still carry and spread. Is that correct?
Like, I just like, you know, once that 95%, you think that they're affected already, you know, they got the vaccine, could they be a carrier? Right?
Right, that's the question, yeah.
Yeah, but it's very difficult to find out, you know what I mean? They could be a carrier and they could, because it's just not been that long that they looked into that. That's the reason they're saying just make sure you practice the isolation precautions.
Okay, because we don't know yet.
Because we don't know yet, yeah.
Okay, thank you. Let's see. Let's see, there's a couple for me in here. I think this one's more for me. It says, so to be clear, you're saying that home-based staff will not get the vaccine when residential staff get it. I don't know 100%. I think it depends on where in the vaccination plan with the state of Illinois those staff will fall. I can tell you that the intermediate care facilities are going to be treated differently because they fall under long-term care. And that's, a bit of a different kind of segment related to prioritization and vaccine distribution. But as soon as we get any clarification on that, I'm sure that Hollis and Brenda will send out updates related to that. One other question too is, will staff be given the choice of which vaccine to get? That I don't know. I don't think so. We're, like I said, we've registered with all of the counties and have reached out to pharmacies such as Walgreens and CVS, and we'll really kind of take whoever will give us the vaccine first. So, we'll be taking that, and then with it being, as Dr. Hameeduddin mentioned, if you take the Pfizer vaccine in the first dose, you need it in the second dose. So I think we want to obviously stay with one brand. Maybe later down the line, as there is more vaccine available, people will have that choice. But I think at least initially in the first phases here at Clearbrook, I don't suspect that we'll get that choice. But if that changes, we will share that as well.
That's the Moderna is coming, right? Because they don't think whatever they have with the Pfizer would be enough, right? So whatever is available, you have to get.
Yeah. Let's see. Here's another one. If you have had COVID, do you need to be vaccinated?
Yes.
Yes, and I heard that on the Illinois Department of Public Health webinar this week also.
Yeah, and I talked about it too, that you have to wait for 90 days. And you don't have to test again because it will stay positive,
Right. So if you had COVID in the spring, then right now you should and could get vaccinated.
You should. 90 days, you should. Yeah.
Okay. So this one is trying to understand about returning of clients that don't live in facilities. Will there be certain restrictions for their return? So I think this pertains to people outside of our residential program. As I said earlier, right now the vaccine is not required. I think that if I can direct that question, maybe if that person can email me just a little more clarification on that. I'm not sure exactly what's being asked there. If I have COVID now and don't know it, asymptomatic, sounds like vaccine wouldn't work within 90 days. If I don't get tested, I'll think I'm vaccinated and it won't work. Why not get tested first? Just need more clarity.
But I really don't know why. I have to probably look into more about that, why they do not, because, it's just very hard. The patients who have asymptomatic, you can't just keep testing everybody before giving the vaccine, unless you have the symptoms, then you just get it tested, and then you just want to make sure first that you have COVID or not. Let's say if you have symptoms, but if you have no symptoms, how many patients walk around have, unless they have exposure? They're saying if they have exposure, then you just wait for 2 weeks, okay, right? But let's say if they're asymptomatic, it's just very hard to say. You can't just keep testing everybody for it, right?
Right.
Yeah.
Let's see. If the vaccine is not required, how possibly compromised can our vaccinated family members be if in contact with non-vaccinated folk? I think what they're asking is, once their family member is vaccinated, what is their risk about continuing to be around unvaccinated individuals?
Well, they have not patients. Let's say if you get vaccinated, you cannot be with an unvaccinated family members because that's the way it's going to be for now, unless for 2 weeks and 7 days after this, 3 weeks, like for a month, you are still kind of, after that you are safe. But till then you are at risk anyways. You're just taking a chance, right? Because the vaccine will be effective 7 days after the second dose, like 28 days after your first for the first dose. Till then, you are considered because you don't develop immunity at all, right? So you could still catch it, you could still that's the best you can do.
And then I think one of the questions is if somebody has COVID and they don't know it and they get vaccinated, is that dangerous?
No.
Okay.
No.
Is there any protection after the first dose but before the second one?
It's the same precautions.
No, any immunity?
No, they have not been reported though.
Okay.
It takes time for the antibodies to develop, right? So even after 7 days, they're saying it's 95%, but who knows? But it has after first dose, there's nothing like a percentage wise. You are 10% safe or 20% safe. They have not studied after the first dose.
Okay. Another question, will Clearbrook be keeping the two groups apart, the two groups being vaccinated versus unvaccinated? And no, that's really in the structure of our organization and our congregate living settings. We cannot keep those people completely separate.
Yeah, it's the same way, like if I get vaccinated, my whole family doesn't, will I be living in the same home? Yes. Right? It's the same way.
Yeah. Who does the vaccine protect, the vaccinated patient or society?
Well, both.
Both, yeah.
Yeah. You are the society, right? So we are the society.
Okay, just checking. If a client has had COVID within 60 days, they should be able to go home for the holidays without any restrictions because they are immune. Like I mentioned, we're keeping our policies and procedures the same right now because we don't know for sure. There's a lot of things that we don't know, and so we're continuing for right now and until we get further guidance from some of our regulatory bodies to keep the current visiting restrictions in place.
No, let's say I'm talking to our pulmonologist, Jessica, but let's say if you have 3 to 4 weeks into it and if they are still symptomatic, the recommendations are to do the COVID IgG antibody. If your IgG antibody is positive, then you are not infectious. Then you can just resume. I have an employee in my office who had COVID, but 3 weeks into it, then we did her COVID IgG antibody, even though he was coughing here and there, and once you have the IgG in you, then you should be fine, but it takes sometimes more than 3 to 4 weeks to develop the IgG.
And do you know what types of allergies, food, environmental, etc., have been associated with adverse reactions?
Adverse what?
Reactions to the vaccine. Was it people with food allergies or environmental allergies or some other kind of category, or just a variety of allergies?
Well, there's no contraindication. If they have pollen allergy, if they have any environmental allergy, they could still get the vaccine, but they need to be monitored longer.
Okay.
And they need to have, everything like in place. Like if they get the reaction, they have epinephrine right there, so, and they have to be monitored more than 15 minutes. As I said, it's only absolute contraindication to the Pfizer product.
Okay. Thank you for clarifying that.
Mm-hmm.
Okay. Well,
But
again,
again, case by case, you just have to, you can never say, okay, you said and this happened, right? It's so new. Things are changing, as you said, every single day. You know what I mean? So it's just like there's no contraindication, but they could have anaphylactic, if they have the resources right there, they should be fine,
Let's see. If a person has a heart stent, are they considered high risk and offered the vaccine in the first phase? Not that I'm aware of. Right now, the first phase is all hospital staff and frontline workers.
It's not based on anything.
Mm-hmm.
Yeah.
Let's see. That's to be clear. Hold on. It's more coming. I lose it. To be clear, Clearbrook has no plans to vaccinate any homebound clients or their healthcare staff. Clearbrook will be offering vaccines to people that reside with us residentially and the staff in those settings as part of one of the initial phases. Not sure if that's the intent of this question or if it's related to something else. But again, it is voluntary for both the individual and the staff working. Are you highly recommending people get vaccinated?
Yes.
Yes, and Clearbrook is encouraging staff and residents to get vaccinated.
Yes, the way this have a choice.
Okay, well, we appreciate your time today. Thank you so much for joining us.
Thank you very much. Yeah, thank you. It's my pleasure always. I hope I answered, most of your questions, right?
Right, and I think we will all continue to have more questions as this progresses.
As we go, we
right.
can look more and more things. Things changing every day. Yeah.
Great. Okay. Well, thank you everybody for participating. We appreciate your time this morning.
Yeah. Thank you, guys. Stay safe, everyone. Isolation, and isolation. Social, right?
Right. Thanks, Dr. Hameeduddin.
All right. Take care, Jessica. Bye-bye.
Bye.
Thank you.